Hi class, welcome to Module 9. Module 9 is on healthcare and disabilities. Now your book doesn't address disabilities, and I added that, so please pay attention as you're going to be looking at all that information through a PowerPoint and some videos. The examination of healthcare is really important for the study of sociology. It is related to social stratification. And for those of you that have known me or looked at my credentials, you'll know that my training is as a medical sociologist. My master's in gerontology, my PhD in medical sociology. And I was working as a hospital social worker when I went back to get my degree in sociology. Amazing what difference medical issues have on our whole world. And medical issues are not limited to the United States, but we're really tight in this battle right now as the administration, our Congress, as they go forward looking at eliminating the Affordable Care Act, which the president once eliminated, which many things have come into place, and it's an argument. But to understand why healthcare is such an issue in society, I think it's important for us to look at that. So I'm going to ask you to look at the perspectives on your own and hopefully not focus a great deal of time on that, but think about a few things within this chapter as you start to examine it. Medicine is identified as a biological pathway to disease, a social perspective of illness. So that medicine is part of the issue that we'll be looking at. And we need to look at the political economy, the corporate structure of healthcare. Medical sociologists look at health in the family. They look at health in the general society, how it makes a difference. They look at the system of medicine itself. We study pecking orders within that social system, just as we do in the family and other areas. And we really look at how health affects our social position, our work, our family, our education, and how it ties into those topics we've already addressed. You can see how clearly it ties into aging. You can see how clearly it ties into the status of family and poverty. Work, as you just finished looking at work and media coming into place, and even what healthcare is there. As you watch those television programs, half the advertisements today, not quite half, but I can get you the right statistic, are about drugs and how they come into our lives. We'll be jumping into the next chapters looking at drugs and addiction and how it's tied to part of the media and how it's tied to healthcare. Sorry for that interruption, but as I told you, I would keep this short as we look at the issues of healthcare here. So there's health inequalities that exist out there. Women live longer than men, yet they have higher rates of chronic conditions. In fact, they start at younger ages, so that we see that significantly. Women's health care costs a great deal more than men. There has been suggestions that women should pay more for health care because they live longer and use more. Men experience higher rates of fatal illness, dying more quickly than women when illness occurs. Significant when we look at what government has put into place. They put in a women's health department, but they have not put in a men's health department because it stated that the health programs were initially just focused on men. There's significant differences facing gender in those issues. And we know that men are healthier when they're married because women monitor their health at a different rate than men monitor their own health. Some very interesting issues within that. Health inequalities also are part of social class. That health determines one's social class, and social class determines one's health. Do you see the catch-22 here? So the lower our social class, the lower our life expectancy, because we don't have access to adequate health care. We are more likely to live in poor neighborhoods, be exposed to violence. We're more exposed to hazardous working conditions. We have inadequate diets. Lots of problems come into place as we start to look at this. And we see poor children are especially at risk. And then we can talk about obesity as part of this issue. Because if I live in a hazardous neighborhood, I'm less likely to be outside playing or involved in activities in my neighborhood. I'm more likely to not have someone home with me, so I may have to stay in front of the television as my babysitter. So there's a lot of inequalities that occur here. Education makes a significant difference. The higher your education, the better your health. Now, is that because you know more? Is that because you're more educated to healthy lifestyles? Part of that comes into effect. Plus, you're earning more money in many cases, and you have the ability to do that. In some of my research, I look at students and their involvement with their family care physician. For the majority of students in college, they have a regular family care physician, so they have a primary doctor that handles their care, or they have a combined system that comes into place, and they transmit those healthy lifestyles to their children as well. So, what's the problems here besides that? The rising cost of healthcare. The United States spends more on healthcare than any other first world country per capita, per person. And yet, we had what was considered the best healthcare in the world in the 1960s and 70s, and we are no longer considered that. There are high expenses out there that occur. Part of this is tied to the cost of insurance, and part of this is tied to the exploding costs within our health system. So we've got this rising cost of healthcare, and it's rising because of the increased technology, the aging population, our demand for healthcare, the amount of uncompensated healthcare, the cost of prescription drugs, and medical doctors facing the cost of malpractice insurance. Now, doctors themselves have gone away from private practice because it can no longer hold an office that can do all the billing, address all the issues, plus the high cost of their own insurance coming into place, which has changed the system. It becomes a corporate world out there, and insurance has controlled even the healthcare facilities as far as the hospitals. Now, in 2013, we had 42 million Americans were uninsured. With the initiative of the Affordable Care Act, we saw significant changes. That's one of the things your video will address. So I'm not going to spend a lot of time on that. As we start to know that these changes are constantly occurring, as you explore this topic, I want you to think about where you would be in society without healthcare. Healthcare is much more than in the United States. We look at problems with other health insurance programs. Other systems seem to operate better than ours, but they have downfalls as well. In the Canadian system, though you're entirely covered and everyone in the country is covered, there can be waiting lists. In England, they faced a significant issue as far as rural health care. And a much smaller country being able to get to places other than that, but meeting the healthcare. In Germany, when East Germany and West Germany came together, the high cost of the East German healthcare almost bankrupted their system. And when we look at nations as far as their healthcare possibilities, really we look at Denmark as the best system in the world. But remember, it's a much smaller country as we start looking at that. So we can see the impacts and the inequalities of the whole medical system. With that, I bring you back to the disabled population, and I told you early on that we are covering the disabled, not part of your chapter reading, however, something very important to consider, and is a issue for social problems that's not always addressed in some of the textbooks. And part of the disabled, as far as the ASA, the American Sociology Society, part of the disabled group that looks at disability populations. This group was formed almost 20 years ago, and I was initially part of it, and we've really become a structure within sociology to look at the difference of how people are addressed with disabilities and how they fit the same classifications of lack of privilege and prejudice that we saw within race and gender, aging, all of those things coming into place. So a quick review of this will give you some information. However, as you go back into this PowerPoint, you have things to click on and look at. There's no universal definition of disability, and there's no clear definition of normalcy. So when we think of we can clearly see that disability is a social construct. There are 4 broad categories of disability: physical disability, intellectual disability, and cognitive disability, and then psychiatric disability. All of these play into the factor of what we consider disabled. Now, physical disabilities include visual, hearing, sensory loss, mobile impairment, and health disorders. Intellectual disabilities are mild, moderate, and severe and profound mental retardation, and that's a really broad category. Cognitive disabilities include learning disabilities like dyslexia that I have, traumatic brain injury is significant in here, and it falls in this area which is not well covered. And then we have psychiatric disabilities. Some of you have already started to think about the focus on this, the mental illness, autism, and chemical substance abuse. Again, all of these falling into the categories. So why are there more disabled people than ever before? I've moved this to the full PowerPoint because you'll be able to see it a little bit better here quickly instead of it overwriting. A lot of it is no surprise to you. We've got advances in neonatal medicine. We keep more children alive. We keep children alive born less than a pound today. And they have some severe problems when born at that lower level. We know multiple births are more likely to have things like CP, and other problems. We have the advances in modern medicine in emergency and trauma. We have the aging populations, and we have persons with disabilities living longer. In the past, children with Down syndrome would grow and become adults and usually die by the age of 40, and we see that population aging significantly. We're staying alive into their 60s and 70s, and with a high rate of Alzheimer's that starts in their 50s, that we have some issues. We have more accurate counting as we look forward, and we also see changes in how we define people with disabilities. So the sociological model of disability emphasizes the social forces and the public issues rather than the individual physical variations and trouble. It's very different than the medical model that drops a person into the spot. When I was working in the hospital and we looked at individuals with disabilities, we would definitely separate them from the stroke patient, from the spinal cord injury to the head trauma, and that focus, that medical model was on their health related to that disability, and they actually got labeled as their disability. On the rehab floor, we dealt with them as a whole person. If they were on another floor, there were oftentimes, well, they're here for this particular issue. I'm not dealing with the rest of their problem. And so there was a lot of times that we would move a disabled person off a med surg unit back into a rehab unit, because then we could address them as a whole and their social forces around them. So the issues for them in these two models become very different of how we look at that population. If we focus on that medical issue and we don't look at the sources of prejudice and discriminations, we fail to look at what affects them in society. What's the sources? Why are they feared? Economic threat, there's maybe a safety threat, there's an ambiguity in how it is described, their disability. Think of the fact of, why is a person disabled? We have the biblical belief that the sins of the parents are brought down on the children. Hopefully most of that's gone away, but there's this defining nature of disability as a person is not capable, is doing enough. There's the overgeneralization of the facts of the disability. There's the moral accountability, as I've already mentioned, and the moral accountability for the manage of the disability. Why is a person sick? Why has that person not cared for their needs better? As a person with diabetes and they're losing a limb, well, if they would have monitored their condition better, it might have not come to that. So there's the inferred emotional consequences, and there's this emphasis on beauty, fitness, and youth. And we can see how that pops out from some of the other issues we've described. It's a change in the effect of lifestyle and relationships, and so we see such things as managing stigma. Goffman, and we talk a lot about stigma, and we'll talk about this in crime as well, sees that the issues include social disgrace and the ability to pass as normal in society are important theoretical pieces that we look at, and the power of the sick role. The disabled are no longer able to seek that cure that you looked at as you looked at the chapter before. So important things for you to think about as we start looking at the disabilities. So it's a very limited presentation for you as you jump in and out of some of those things and you follow up with looking at some videos on this issue. I want you to think about how disability is increasing in the world because we keep people alive. In the United States, we have this increasing population of disabled. About 19% of our population is considered disabled. Now, other than when we consider minorities as females and minorities, this really is our largest population of a minority. Families have some real high expenses, and they are the main responsibility of that. And as you explore those theories, you'll be able to look a little further. Well, I've tried not to divide this into two videos as I've done in the past because summer is so busy, and I've eliminated a lot of discussion on this topic and just brought you to a discussion board on disabilities. You do have a few things to watch here. Just a wonderful TED Talk by Amy Mullins to think about disability in a different manner, and some quick little information on the Americans with Disability Act. Again, there's so much that can be covered in this chapter, and this is why we offer the course in Sociology of Medicine, which will be offered in the spring. Something to consider as you start tying this into the multiple social problems. Have you been without insurance? What's it like? We're going to be changing back to a system that will allow people to choose not to have insurance. Remember, still 10% of the country did not have insurance. It was cheaper for them to take the penalties, or they still couldn't afford it and were hoping to avoid being caught for the penalties to be without insurance. How's it affect society? And I know that we have some medical personnel in the class. I'll be very interested to see how you look at this. Remember, there are multiple sides, not just two here, multiple sides of the issue as we start exploring the inequalities that happen within the healthcare system. Have a great day.